So let's talk about our next question. That is, a 43 years old female presents to the OPD with a changes in the breast and a palpable lump. On examination, the skin is basically thickened and the appearance of PUD orange over the breast, which is the likely diagnosis in this patient. So we have the four option. Option A, that is T3, option B 4B, option C, that is 4C, and the option D is 4D. So let's try to understand. We are basically nowadays follows 8th edition of the AJCC TNM guideline of the breast cancer. So we have the T4 staging. So this T4 staging is basically there is involvement of the skin and involvement of the chest wall. So these are the two involvement has been seen in case of stage T4, irrespective of the size of the tumor. So your T4 can be categorized into T4A, which is eventually the involvement of the chest wall, T4B, that is your skin involvement, and T4C, that is both skin and chest wall involvement, and the T4D, that is your inflammatory breast cancer. Now here the typical features they have suggested in the question, that is the PUD orange, which basically comes under the scenario of skin involvement. Now what are the other typical features we have seen in case of skin involvement of the breast cancer? So we have the ulceration. Also, apart from the ulceration, like the multiple satellite nodule in the skin surface that can be taken as skin involvement. So the typical presence of the PUD orange, that is basically your edema of the skin. Now what happens is that by the breast tumor that basically involves the skin, so in the skin there is a multiple small dermal lymphatic channels are there. So they basically get blocked due to the tumor emboli. Now this tumor emboli basically obstructing or the blocking the supply of the lymphatics, that will leads to the edema, and we have the multiple hair follicles that basically giving the small pitting appearance in the background of edematous skin, which eventually gives us a PUD orange appearance. Okay, so this is basically taken as a consideration of skin involvement in this case. Now let's try to see like the 8th edition of the AJCC TNM classification of the breast cancer. So T for the primary tumor, that is TX, that is your tumor cannot be assessed. Your T0, that is your no evidence of the primary tumor. Your T1 is that is your carcinoma in situ. So this carcinoma in situ basically DCIS. LCIS was previously there, but nowadays it is not taken into the consideration. So that's why crossing it, that should eventually hit your brain as well. Now the Paget disease without the associated invasive carcinoma or mass, they are also taken under the consideration of the in situ carcinoma. So then we have the T1 staging. So T1 staging is basically the tumor size up to 2 centimeter. Now this T1 again subclassified into T1A, that is less than 1 millimeter size tumor. Now your T1A, that is 1 millimeter to 5 millimeter tumor. From the 5 millimeter to 10 millimeter, that is your T1D. Now your T1C is more than 10 millimeter, but up to 20 millimeter or 2 centimeter, that is basically your T1C. Okay. Then we have the T2. So this T2 tumor is basically the tumor size from the 2 centimeter to 5 centimeter, and more than 5 centimeter is your T3. Then we have the T4, T4A, that is chest wall involvement. So here I would like to mention is that while taking the consideration of the chest wall involvement, if the tumor basically involves into the pectoralis major or the minor, that is not going into that is not taken into the consideration of the chest wall involvement. It is very much important. Okay, it is a very much important according to the MCQ perspective as well as clinical perspective. We have the 4B, that is your skin involvement. 4C, that is both skin and chest wall involvement, and the 4D, that is your inflammatory breast cancer. Now we have the N staging, that is a regional lymph node staging. So the NX means lymph node cannot be assessed. N0, that is no lymph node metastasis can be recognized. NOI plus, that is your isolated tumor cells in the node that is less than 2 millimeter. Now, not counted as a positive node. Okay. Also, we have the molecular evidence of the metastasis, but not histological. That is again taken here in the TNM staging. Now, we have the N1, that is your 1 to 3 axillary lymph node or internal mammary lymph node. N2, that is your N2A, which is your 4 to 9 axillary lymph nodes. N2B, which is clinically detected internal mammary lymph nodes without any axillary involvement. Okay, so without any axillary involvement. So this is your N2 stage, and the N3 is the advanced nodal disease, where the N3A, that is basically more than 10 axillary lymph node or infraclavicular lymph node. Infraclavicular lymph node. We have the N3B, that is your internal mammary lymph node, and the involvement of the axillary lymph node basically coexist either clinically or by imaging. Then we have the N3C, that is your supraclavicular location of the lymph node. Okay. Then we have the distant metastasis. So the N0 means no clinical evidence or radiological evidence of metastasis. Clinical M0, but I plus, that is your molecular or microscopic evidence of tumor cells in the distal sites, but no clinical or histological evidence or radiological evidence is there. M1, that is your distant metastasis is there present. So lungs, liver, bone and brain. So these are the common areas where normally metastasis happen. Now, in this question, there is a skin thickening. They have already mentioned that, and there is the appearance of the PUD orange over the breast. So it's a pretty much straightforward question. You have to answer this. So your here the answer would be P4B.